Did you know that by the time you finish watching this video, around 10 out of 9 seniors will have been diagnosed with arthritis or dementia? But here's the terrifying part. What if the cause isn't aging by your medicine cabinet? You've been told these pills are safe, routine, even essential. But new research is sounding the alarm. 99% of seniors have no idea that at least one medication they're taking could shrink key memory centers in the brain by over 28% in less than a year. In fact, a 2023 study in neurology and aging research found that one class of drugs increased dementia risk by 49% in seniors within just 2 years of use.
Did you know that many of the medications and supplements you take daily must pass through your kidneys, and that some of them, when misused, can silently damage these vital organs, sometimes leading to chronic kidney disease or even kidney failure? Unlike the liver, which can sometimes regenerate, once your kidneys are damaged, the loss is often permanent. In fact, more than 850 million people worldwide are estimated to live with kidney disease, and medications are a hidden factor behind many of these cases. In today's video, I will share with you 10 medications that can damage your kidneys, the warning signs to look out for, and why it's so important to use them carefully. Stay with me until the end, because the number one medication on this list is one of the most common painkillers in every household. Number 10. NSAIDs, non-steroidal anti-inflammatory drugs. Examples: ibuprofen, naproxen, diclofenac. These are some of the most commonly used painkillers worldwide. They reduce inflammation and pain, but when used excessively or for long periods, they reduce blood flow to the kidneys. This can lead to acute kidney injury, especially in people with pre-existing conditions like diabetes, high blood pressure, or dehydration. So yes, that over-the-counter painkiller in your cabinet may look harmless, but if taken recklessly, it's a real kidney enemy.
Be honest, how often do you take ibuprofen or painkillers when you have a headache? Daily, weekly, or rarely?
Number 9. Certain antibiotics. Examples: aminoglycosides, gentamicin, tobramycin. These antibiotics are powerful life-saving drugs, but they are also nephrotoxic, meaning toxic to the kidneys. Gentamicin, for example, can directly damage the kidney's filtering cells, especially if taken for more than a week or at high doses. Vancomycin, widely used in hospitals, is another risky one if not carefully monitored. That's why doctors often check kidney function during antibiotic treatment through blood tests.
And tell me, out of these 10 medications, which one shocked you the most? Was it the everyday painkillers or the ones used in hospitals? If you're on blood pressure meds, do you get your kidney function checked regularly? Type yes if you do, no if you don't.
Now let's look number 8, which is proton pump inhibitors. Examples: omeprazole, pantoprazole. These medications are used for acid reflux, ulcers, and heartburn. While generally considered safe for short-term use, studies have shown that long-term or unnecessary use may increase the risk of chronic kidney disease. The problem: many people take PPIs daily for years without medical supervision. That little pill you pop for heartburn could silently scar your kidneys over time.
Many people take heartburn medicine for years without thinking twice. Do you think these should be sold freely at pharmacies or only by prescription?
Now let's look number 7, certain antiviral drugs. Examples: tenofovir, used for HIV, acyclovir, used for herpes. These drugs are critical for controlling viral infections, but some, like tenofovir, can cause a condition called proximal tubulopathy, where the kidney's small tubules fail to reabsorb important substances, leading to electrolyte imbalance and kidney failure. Acyclovir, especially if taken without enough water, can form crystals in the kidneys, causing painful kidney blockages. Now let's look 6. Diuretics, water pills. Examples: furosemide, hydrochlorothiazide. These drugs help reduce blood pressure and swelling by making you urinate more. While life-saving for people with heart or kidney disease, overuse can backfire. Excessive diuretic use can cause dehydration and electrolyte imbalances, straining the kidneys and worsening existing damage. So while they're essential for some, they must be used under careful medical supervision.
Now I want to hear from you. Have you ever experienced kidney problems or been warned about a medication by your doctor? Or do you know someone who had side effects from one of these drugs? Share your story below. Your experience might help someone else watching this video. If you know someone who's gone through chemo, did the doctors warn about kidney risks?
Next 5 medicines are most dangerous. One which lead to kidney failure. Number 5, lithium, used for bipolar disorder and other mood disorders. Lithium is one of the most effective psychiatric medications, but long-term use can lead to lithium-induced nephropathy, a condition that scars the kidneys and reduces their ability to filter blood. Patients on lithium often need regular kidney function tests. It's a great example of how a life-saving drug can still be dangerous if not monitored properly. Chemotherapy drugs examples: cisplatin methotrexate. These medications are powerful cancer fighters, but they're also among the most toxic drugs to the kidneys. Cisplatin in particular can damage the delicate kidney tubules. Doctors usually give IV fluids before and after chemo sessions to help flush the kidneys and reduce damage, but the risk is always there.
If you or someone you know has ever been on long-term medication, did your doctor check kidney function regularly? Let me know in the comments.
Now let's look 3. Contrast dyes, used in scans and MRIs. Contrast agents used in CT scans or angiograms can cause a condition called contrast-induced nephropathy. For most healthy people, this risk is small, but for patients with diabetes, high blood pressure, or existing kidney disease, it can cause sudden kidney failure. That's why doctors always check kidney function before giving contrast dye. Now let's look to ACE inhibitors in certain cases. Examples: lisinopril. These blood pressure medications are actually protective for the kidneys in many patients, but in some situations, especially when combined with dehydration or NSAIDs, they can cause kidney function to drop suddenly. This doesn't mean they're bad drugs. It means they must be used carefully with regular monitoring.
Most dangerous medicine is overuse of painkillers, especially acetaminophen and NSAIDs combo. Yes, the number one culprit is something most of us have taken at least once. Acetaminophen, paracetamol, especially when mixed with NSAIDs. While acetaminophen is mainly linked to liver damage, long-term overuse or mixing it with other painkillers has been shown to increase the risk of chronic kidney disease. In fact, analgesic nephropathy is a well-known condition caused by excessive painkiller use. So, the very drugs we trust for quick relief can slowly destroy our kidneys if abused. Important warning to you before you panic. If your doctor has prescribed any of these medications, do not stop them on your own. Many are life-saving. The key is dosage, duration, and monitoring. Always take medications as prescribed. Drink enough water and get regular kidney function tests if you're on long-term treatment. Your kidneys are small but mighty, just the size of a fist, but responsible for filtering your entire bloodstream every single day. Protecting them means protecting your overall health and longevity. So, which of these medications surprised you the most? Did you already know about the hidden risks of PPEs or NSAIDs? Let me know in the comments. And remember, share this video with your friends and family because most people have at least one of those medications in their home right now. Don't forget to subscribe for more health tips and stay tuned for my next video. Until then, take care of your kidneys because once they're gone, they're gone. Now I want to hear from you. Have you ever experienced kidney problems or been warned about a medication by your doctor? Or do you know someone who had side effects from one of these drugs? Share your story below. Your experience might help someone else watching this video. And tell me, out of these 10 medications, which one shocked you the most? Was it the everyday painkillers or the ones used in hospitals? If you're on blood pressure meds, do you get your kidney function checked regularly? Type yes if you do, no if you don't.
Your kidneys are like the body's natural filtration system. Every day, they filter about 50 gallons of blood and remove waste, toxins, and excess fluid, turning it into urine. They also regulate blood pressure, maintain electrolyte balance, and even help produce hormones that keep your bones strong. But because of this constant filtration job, the kidneys are highly exposed to medications and their byproducts. Some drugs can irritate the kidney tissue, reduce blood flow, or build up toxins that the kidneys can't handle. And when that happens, kidney damage begins. So what are the early warning signs that your kidneys may be suffering from medication-related damage? Look out for swelling in the legs, ankles, or face, unexplained fatigue and weakness, foamy or dark-colored urine, difficulty urinating or urinating much less than normal, persistent nausea, vomiting, or metallic taste in the mouth, high blood pressure that seems difficult to control. Unfortunately, in many cases, kidney damage develops silently, without noticeable symptoms, until it's too late. That's why awareness is so important. And now, let's look at the 10 medications most linked to kidney damage.
Have you or your parents ever been prescribed water pills? Did you notice needing to run to the bathroom more often? If yes, let me know in the comments. Would love to hear your feeling about this. Many people take heartburn medicine for years without thinking twice. Do you think these should be sold freely at pharmacies or only by prescription?